Yes. वो कहते हैं ना, my friend has this ringtone. I'm going to sing that. किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो दे उधार, किसी वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है. थैंक यू
सर. गोवा में भी आपको गाना पड़ेगा एक बार.
यस बिल्कुल.
So hello and welcome friends to the new episode of Hall of Fame. And today we have with us Dr. Satish Kamat. He is a renowned oncosurgeon in the Mumbai Thane, and he has been in practice for last 30 years. So your experience will be very useful for this interview. So you have seen the ups and downs in the life, and you have seen the struggles also, and finally success also.
Definitely, when we started, I was the only person from Thane downwards.
Yeah.
So it was a very hectic time when I started. I used to operate round the clock and this nursing home, that nursing home, and then slowly stabilized. The most important thing, however, what I did was I kept a discipline for myself.
Right.
I never worked after 10 p.m. That was
Okay.
Now after 8:30 p.m. I don't work. And secondly, Saturday, Sundays, I don't work as far as possible.
Okay.
I keep it for family or meetings, or I'm secretary of a lot of clubs. So
Okay.
I organize meetings and everything, not necessarily medical, non-medical also. So I arrange social meets and all that. So Saturday, Sundays, I keep it for myself. And when I started practice, of course, it was with nothing there. And now we have reached an era where there's laparoscopy, robotic surgery,
Yeah.
and you name it, everything is there. My own setup is at Asha Cancer Hospital at 3 from Thane. It's a 15-bedded nursing home. And just yesterday was its 21st birthday. So
Yeah.
we had a great celebration and everything. And hopefully things will move in the same direction, in a better direction.
So tell us about your background and childhood. Like, always wanted to become a medical doctor, and
I was the first doctor in my whole Kamat family.
okay.
My dad was a catering manager at Siettas, and mom was a housemaker. And she insisted, so I went to a English medium school.
Okay.
At that time, it was very rare and very expensive. At that time, St. John Baptist High School.
Okay.
She was the main force who forced dad to push us through this. Me
Right.
and both my brothers who went there.
Okay.
Things moved on, and through a modest building, we are touched wood. We are now. I have this center, and my other one brother is in UK. The other is in Canada.
Great. So your mom was the inspiration.
Yes. Mom was a housemaker, and she's still the strength of the family who
Yes.
manages everyone. And of course, unfortunately, I lost my dad in 2003.
So why onco surgery, sir?
Onco surgery, actually speaking, surgery was my aim, general surgery, there's no doubt. After MS, I started my practice, let me be very frank, and as soon as I started practice, the first 5 patients were all cancer.
Okay.
In my limited 1 month of private practice. So I said, first 5 days, I have 10 cases of cancer, I better learn and come. Because
Right.
in MS, at that time, cancer was a bad disease.
Yeah.
Patient never survived. It was very bad, very depressing.
Yeah.
So, and with God's grace, I got into Tata Memorial Hospital, and then things were different.
So what was special about Tata? The learnings from there.
Tata is Tata. Let's be very, very
I
frank.
know that.
The absolute exposure to, you name it, from head to toe, everything. The superb bosses, Dr. Vyas, Dr. Rao, Dr. Desai, you name them. I can't name everyone. Dr. Sultan Pradhan and Dr. Jagannath. Everything was exposed. We were, at that time, we got exposure into all of oncology.
Right.
Not like now, there is super specialization.
Yeah.
Only breast, only head and neck, only colon. It was not so. At that time, unfortunately, lab was starting. So initially, I had suffering with laparoscopy being my day. But now we have taken over and started doing lab work also.
So you had already decided that you will become a private practitioner?
Yes.
You do job anywhere?
It was always in my mind that I'll start my private practice. There was no question. I never applied for any government job.
Wow. You're entrepreneur at core.
Huh?
Entrepreneur at core.
Yeah. That is true. Basically, my aim was work for yourself.
Yeah.
Rather than for someone else.
Right.
You earn X, it's for you. Over
Right.
there, whether you earn X, Y, Z, it is always shared and depends on the whims and fancies. Today I am there, tomorrow you'll be kicked out, someone else may come in.
Yes.
So here I am my own king. I can decide I will not work, I will work. This is not mine, this is mine. And as far as my comfort level, I am little picky. I'd like things to be in a comfortable zone.
Control manner.
Yeah. I have a small setup, but it has got everything which a big hospital has.
Right.
Let's be very frank. I have 2 state-of-the-art cauteries, state-of-the-art boils machine, state-of-the-art light, OT table, laparoscopy, stores, instruments. So there is no cutting corner just because it's a nursing home. My beds and all are fantastic, monitors everywhere. I have 2 ventilators, which I have not used even once.
Okay.
Because luckily we don't need in my setup. It is, but I have it. I have no standby defibrillator. You name it, I have everything. But that's where I was pleased. I have a big nursing home OPD, which is not very cramped. So I have kept less beds in a 3,000 square feet area. I have put only 14 beds and made it lavish exactly.
So 20 years ago,
Yes.
when you're starting,
Yes.
what were the challenges?
Challenges were a lot. Let's be very frank. So main was finance. People were not sponsoring as easily as they sponsor now.
Right.
The finances were not so good to get in. But touch wood, everything has gone fine, and I've been running around and getting my things done. Today much better, but of course today there are new challenges coming up comparatively.
What is your mantra for the private practice people?
Don't compare yourself with another private practitioner.
Right.
That's most important. Don't compare with the government. Do what you are good at.
Yes.
And don't, I should do this, I should do that. Know your own limitations.
Right.
And be sincere in your approach. That's the most important. And availability. If you are available, patients are there.
Then patients will definitely come.
And respect everyone's time.
Right.
That's very important. You call someone at 10 and then you come at 1 a.m. Or 1 p.m. whatever is not right.
Right.
Call at 10 unless necessary. Don't delay beyond 15, 20, 30 minutes.
So oncosurgery has come a long way. Earlier it was not a branch which was many patients were surviving. Now the results are better.
Exactly. So results, they are the same. Let's be very frank. There is some improvement because of newer immunotherapy protocols coming up.
Okay.
The blood bank facilities are better, which were not there at that time.
Right.
The newer cautery machines, the bleeding is less. The ERAS facility, the patient recover faster, they move faster.
Okay.
So all this stuff, and robotic has now come in the picture, but of course it's very expensive.
Yeah. So tell me about how did you manage your staff?
Staff, very frankly, it's my better half.
Okay.
She's the one who looks into it. She's a pediatric surgeon.
Okay.
So she has sacrificed her practice for our children and the staff. We have an administrator who looks after the main things, but troubleshooting is mainly by ma'am. And if it doesn't settle, then it comes to me.
So your hospital as well as your home, both are managed, madam?
Yes. Children are managed, home are managed, hospital managed. She's the main force to manage everything.
It's like Ashtapuja. Great.
Yes.
So how has been your experience with the newer technology?
See, that's what I said. Unfortunately, initially I was not very happy with the labs, laparoscopy. Now I picked up. Now I'm doing robotic surgery, which is just starting, and I find robotic far better and easier for me. Okay. And newer technology, my whole hospital is digitalized. I am paperless. I have tabs and everywhere where we write with the tab, and it's all computerized. Everything is computerized in my setup. But I don't type. I write.
Okay.
So I don't type and give prescriptions. I prefer my OPD is also with a digital pen. Okay. So all papers are recorded on my mobile, so which is easily available wherever I go and get things done. Then new which AI is coming up is a little bit challenging for me. Of course, my son is guiding me there how to move around that. So that's the big thing. But it's a challenge for everyone. We have to accept it.
Yeah.
The biggest challenge is managing Google and AI trained patients.
Right.
They have a lot of queries and which they are already answered, and I remember the first patient just sat like this asking me questions. So after answering me, you answered everything correctly. He had all the questions and he was reading as I was answering. Thank you very much, Bola.
There is no option now with us.
Yeah.
You have to embrace the technology and become one step ahead.
Let's be very frank. I am very open about it. I give an open choice. You are free to take second opinion, third opinion. I say that this patient, as far as in oncology, especially genuinely, 3 doctors will manage differently.
Yeah.
No one is right, no one is wrong.
Right.
Let's be very frank. Mine is patient-centric. My approach is patient-centric. I don't treat cancer-centric. So it may not be necessarily, sometimes nowadays all chemo first. It may not be chemo first in me. Sometimes in India, poverty is a big issue. Let's be very frank. So sometimes it is easier to remove it and then the patient don't take chemo, and also they are far better off. Even with surgery, they recover.
Yeah.
I don't necessarily give neoadjuvant therapy. That is the only where I fight with my chemotherapist. Boss, don't drug them so much that they can't get operated.
Right.
Even in advanced cases, I do a lot of excentrations and all, which are supramajor where the stool comes out, urine comes out. But the patient is so happy. They survive for 2 years
Longer.
depending on this. Whereas if they keep on giving chemo and everything, they are in a misery.
Yeah.
They are in a misery. So you have to be patient-centric. See the age of the patient, see the finances of the patient, and give a one-stop method which can benefit the patient. To weigh the pros and cons and go that way.
So it is artificial intelligence.
It may not necessarily be according to the guidelines. Let's be very frank, but it's not wrong. It's that way.
Guidelines are also made by surgeons and physicians only.
Yeah, nothing is 100%. Let's be very frank.
It keeps changing also.
Yeah, it keeps on changing.
So artificial intelligence is there, but human intelligence will never be surpassed.
That's true. I hope so. See, that's the sad part. I gave a talk on AI last month. And that time I told that I am not worried about the AI coming up. I am worried about the HI going down.
Right.
So that is the sad part. We are losing our common sense. We are losing our human intelligence. Very frankly, we also have. I don't remember my other person's phone number.
Yeah.
I have to see it on the data. One time I used to know 50, 60 phone numbers
in the head.
That's true. Now I can't. I don't remember it. So sometimes I forget the second or third one. So sad. Yeah. Anything required to us, everything was in our human computer.
So how long you have been member with us, sir?
It's long. Now more than 3-4 years. Since start, I'm a diamond member of yours.
Yeah. So how has been experience?
No, I'll be very frank. I'm not been very sincere in attending. I attend once in a while because I have practice and everything. And sometimes your talks are after 9:30.
Yeah.
That's one thing. I sleep at 10:30.
Okay.
I sleep early. I get up early. I get up at 5 o'clock.
Okay.
And day starts at 5.
So you can always see the recordings.
Yeah, I see the recordings. That's what I said. Next day I see the recordings. In fact, I go and see that's what I like about you. Your YouTube videos and all, which I have the link to. I have still to see a lot. I'm not saying no, but I like it. The zid with which you and others have done it. How you have come out through your struggles. Yeah. Hats off to you too. Great job.
So your kids are not doctors?
Both of them are not doctors. The first one never wanted to wake up. So he had only Ekat Laksha IIT.
Okay.
So he did only IIT, nothing else.
Yeah.
He went into IIT. The second one has his own problems. So he's gone into hotel management.
Okay.
So from hospital industry, he'll go to hospitality industry.
Yes. That is a booming sector.
Come on that day to help us out a little bit.
Yeah. So it is also a booming sector.
Yeah, of course. Yeah. It has its own set of troubles. That's a big issue. Let's be very frank, but that's okay.
You're attached to many hospitals and you give time to a lot of
I am attached to 2-3 charitable centers and one big hospital called the Jupiter Hospital. Yeah. But mainly it's my own setup.
So basically, how do you manage your time in all these places? And how do you manage your time on weekends?
That's what I said. I work Monday to Friday.
Okay.
Nowadays, no one is there, so Saturday morning I work. Otherwise, Saturday I never work. After 12:30 Saturday, everything is by me time.
Okay.
So I sing, I dance, I'm trying to learn some music, but वो नहीं जम रहा है.
Okay.
तब मैं गाऊंगा ना आपके प्रोग्राम में.
Yes, definitely. It is for all of the doctors, but for everything is not about medicine.
Yes. One thing is there, I believe in the philosophy that live for today, tomorrow never comes.
Yes.
And I listen to religious discourses and all. So just yesterday I heard one very important thing. I think you must be knowing this. So this fellow said, come on boy, you have now gone and you meet God. And God say, you say, I want to take me in heaven. He says, where have you come from? He said, I come from earth. Oh, sure. I gave you such a beautiful place. I gave you animals. I gave you mountains. I gave you sea. I gave you river. I gave you everything. And it is up to you to make it heaven.
Yeah.
You are actually coming from heaven. So you decide where you're staying, whether you want to make it heaven or a hell.
Yeah.
Don't expect something different when you meet me here.
5.5 days of a cancer surgeon and 1.5 days of the normal person.
Yes, 1.5 days normal person. Enjoy. Right. I like to socialize a lot. I don't believe in all WhatsApping and I go and meet people in person. I want to meet you. You prepare something for me, I'm going to eat with you or whatever. I come. That's it. So they are inconvenienced maybe, but there's no shame. I said I want to meet you. There's nothing.
You're like an old style.
I get an intuition. So I don't know. So they need my help. So somehow I reach them when they need my help. God has touched wood help me there. So
that is very nice to hear.
Yeah.
Yeah, you're saying something. We
we have to remain in touch with everyone. There's no doubt. The human touch is most important. You have so many Facebook friends, WhatsApp friends who give you thenga, thenga, thenga. And ye tabhi bhi thenga dete hain. So what we need is a human being who will come to you at 2 a.m. in the night if you call him.
Right.
You need that group of close friends who will help you irrespective of what time it is, what day it is, and everything. It's not. I'm not talking of financial help. It's not. I'm not talking of loan and all that. I'm talking of just being there for you in your difficulty or in your happiness, both.
Right.
It's always you are always happy when you share your happiness.
Yeah.
And your sadness reduces again when you share it with someone.
That is a great
Sharing is always important, and in person more important than just on the digital platform.
Great. And you are a member of many organizations?
Yeah, I am a member of a lot of organizations. One of the recent ones is I am one of the founder members of a gastrointestinal foundation, Thane, and we are a like-minded GI surgeons and endoscopists. The only team where medical and surgeons are together, behave in one direction. There's no fight between the two. And we organize a lot of conferences for teaching programs for youngsters and all. We treat free endoscopy sessions, how to do colonoscopy, gastroscopy, and we call who's who of the whole of Bombay, whole of the country, and we hold a conference in Goa only, alternate years. So it's well attended by, but we have a very close group. So around 250, 300 people who attend and are treated with academic and culinary feast at Goa every alternate year. And again, of course, IMA is there. I was, but now I'm not a Rotary Club member. And a lot of social, smaller. I have my own trust. That's very important. Asha Cancer Trust, to which we give free chemotherapy medicines and all that to my patients. And I hold a lot of survivor meets.
Okay.
So a lot of cancer patients, survivor meets, I give them, they talk to each other and improve the morale of the patients. Nowadays, I am having a project on planning. It's not at coming to work. How to take care of the caregiver.
Okay.
I'm not talking of medicals. In my setup, especially, we have found that wife is a patient, husband is neglected. So wife recovers from her cancer and the husband passes away because of MI, uncontrolled diabetes, or some problem. Similarly, vice versa. Husband is the patient, wife doesn't take care, so she has problem because of malnutrition.
Right.
The children suffer because of taking care of the parents and they lose their education and all that. Right. So this is where I'm planning out something. So if we meet and we could discuss something out whether.
It's a very good thought, sir. Because what happens is that so many times the patient is recovering, but the whole family goes into depression.
It is not just depression. It is in general.
And then somatic things also come in.
Yeah, neglect.
Neglect.
Family gets neglected.
We'll talk about that when we meet in Pune.
Yeah. I think when you unfortunately were not well, I'm sure everyone has gone through that.
Yeah.
It's not easy. And such chronic diseases, aggressive diseases, it's much more so.
Yeah. What do you do for a branding and marketing, sir?
That's where I lack. That's where I lack. I have a own website and WhatsApp page or something. Instagram I do, but that is where I lack. It is not taken off.
Now we'll take it off, sir, with you.
We have to meet and discuss. Let's see.
Yeah.
I am trying it out, but there is resistance on my part. There is some sort of resistance which happens. It doesn't take. Now I started Google feedbacks and everything.
Okay.
I had enrolled for Just Dial and all that, but those are all paid.
Yeah.
My thing is word of mouth publicity. Maximum patients come to me from patients only. They only refer me patients. So that's the way it's good. It's not. That is lacking on my part. There's no doubt. It's okay. What to do?
We'll make it easy for you. Don't worry.
Thank you.
What is your message for young people who are entering this branch, oncosurgery?
Yeah, it's tough, but don't give up. Give your best, and most important, again, like I said, don't compare.
Yeah.
Do your best. And avoid jostling. That's medical jostling. Don't degrade your colleague, senior, junior, or whatever, because one person's patient is going to go to the next one. Next one is going to go to the third one. Third one is going to come back to the first one. And like I said, cancer management, especially for cancer, for everyone, there are different approaches. So never belittle, what did that fellow do? He didn't do this right. So you do what you think is right. Do what is right as far as the literature is concerned. But at the same time, don't belittle your colleagues. We never know the whole picture. They only come with a small chit and you suddenly start howling, oh, what man, where did you go? What did you do? Don't do this, don't do that. You should not have gone to him. No. That's not to be done. You practice sincerely yourself. And like I said, my dad always told me, Niki kar darya mein dal and every day help at least 2 people.
Right.
Without expecting any returns. So that's
So great. It was very good interacting with you, sir. Your
Yes.
ethical practice and your ideas are really very powerful. Keep attached to that. Don't leave that, because you are actually taking care of the old rules, but they are actually still working now, right now. These are the things which you should be doing more and more of, and networking more and more of, improving your skills and learning all the way through as you are growing.
yes. My friend has this ringtone. I'm going to sing that. किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो दे उधार, किसी पासते हो तेरे दिल में प्यार, जीना इसी का नाम है. Thank you.
सर, गोवा में भी आपको गाना पड़ेगा एक बार.
Yes, बिल्कुल.
Great talking to you, sir.
Thank you.
Thank you.
Yeah, great. Thank you.